Hey everybody, I'm sitting down with my friend Barry Lieberman, who's a psychiatrist in Beverly Hills, and we're going to talk about medication, so stay tuned. Without further ado.
Well, because I'm a person who will see anybody who walks in my door, as I've told you before, I'll do psychotherapy for almost everybody, but about half the people that I see really need medications. And that need will vary from dramatically when they're severely depressed or having severe panic attacks, or if they have a major mental illness such as bipolar 1 disorder, manic depressive disorder, or schizophrenia. Most people don't have that. You know, schizophrenia is about 2% of the population. Bipolar is about the same kind of percentage. People with major depression or major anxiety syndromes are more frequent, but with them you might only use medications for a chunk of time. But it is really important to see that the medication is part of the combination of psychotherapy and medication, because even if it's almost essential that they take medication, as in they're going to do very badly without it, they still need to address other issues in their life and how it's affecting them and so on and so forth.
Yeah, because nothing happens in a bubble. Like we don't, especially if we have bipolar 1 disorder, mania can cause a lot of strife in our relationships and a lot of other issues, even financial issues. I have had a client who used to, when she was manic, go on shopping sprees.
That's correct.
And so there are a lot of things, and like I've said before to many of you and in many videos, like the two together with therapy and medication gives the best outcome. We know that through every research that's ever been done on that subject.
But that makes the point that, of course, that medication is one of the tools of treatment. And with some people it's essential, and other people it's helpful, and some people it doesn't help.
Yeah.
And finding out that it doesn't help is also a very interesting thing to discover.
So if you were starting someone, you decided that they did need medication, how would you go about picking it? And deciding how long, I guess?
That's
based
actually
on severity.
Well, that's actually one of the toughest. Deciding how long, that I like. I'll clarify that in a moment. Because, well, the point of that is you decide on how long only if it's worked, and so if it's worked, then you welcome that decision. But it is not necessarily a lifetime thing. It depends on the condition. There are people. Sometimes there's things called situational stress disorder, where something has happened in that person's life: the breakup of a relationship, the death of a loved one, the loss of an important job, and people will not only have a grief reaction, but that grief reaction may be prolonged enough to really cause them to go to a lower level of functioning. Then we'll call it depression or anxiety disorder or whatever. And medications really help that, but there you're usually, your intention is to do a short-term medication use, 3 months, 4 months, 6 months, whatever it is. I'll always tell people that if it's worked for them, I'm going to try to get them to take it for 6 months at least.
Yeah, and that's what I've heard too. Many of my clients have said the same coming back, that 6 months is like a fair trial.
That's right.
Because we want to make sure that we're taking the right amount, which sometimes it takes a while to titrate up.
Well, but that 6 months is if it's working for them.
Okay. We have to remember it's all based on if it works.
Because the newer medications, the newer and better medications, whether antidepressant, or anti-anxiety. Anti-anxiety medications work right away. They're drugs. You know, Xanax, Klonopin, Valium, etc. They either work that day or not, or even stimulants when you're using those. They work that day. Antidepressants, antipsychotics, or low-dose antipsychotics, which we'll use to augment antidepressants, which are an extremely effective thing and scare the hell out of people when they see the ads on television. Oh, when you see the ads for the antipsychotics, I always tell people, either I used to joke, stop reading, or now stop watching television, because the small print, especially when you hear it recited on a television ad, scares the shit out of you. Yes, you know, that's right. You think I'm going to die, and it's a major problem for me, because I'll say there's a wide range of these different medications, from minimal side effects to maximum, and they have to report everything in that category. So a lot of times part of my use of medications is to explain to people that what we're going to do is not going to kill them.
Yeah.
I've never had, in 43 years of practice, I've never had anybody have anything really bad happen to them. A lot of my medication work is to reassure people about what medications are and aren't.
Yeah, and I think it's important to ask those questions when you see a psychiatrist if they aren't educating you enough about it or you still have concerns, because I feel like that's a really important part of what Barry does, is letting you know what the potential side effects are, what to let him know about.
And by the way, philosophically, I don't think any patient should take any medication that they don't understand why they're taking it, what it will do and what it will not do.
Yeah, and so if someone comes to see you, you said only half are on medication.
Yeah.
What is, I don't
Well,
know.
that's because I like to do therapy.
Yeah, and I don't know if you actually have the answer to this, but is there a deciding factor or something that you, is it like severity of the issues that decide whether they're on medication or not?
Well, good question. Severity certainly plays a role. If somebody's coming with mild symptomatology, obviously I'm less likely to use medication. And if they're really suffering terribly, I'm likely to do that. But I still see people who are suffering from very severe depressions and very severe anxiety syndromes, or the secondary symptoms of those syndromes are all kinds of compulsive behaviors, alcoholism, drug abuse, food abuse, etc.
Yeah.
And relationship abuse.
Yeah.
And that's, of course, gets very interesting and very subtle, because in fact I've had patients who have given medication for one targeted symptom and I haven't even heard about the other difficulties they were having in their life, and they'll say, you know, I was really surprised. I also find myself, I don't know, much more able to be in traffic without getting into road rage or whatever
All the
else.
other
And I didn't even know they were
peripheral.
having that.
Yeah.
And and there are people who I intended to take off of medications, and talk about antidepressants, after a few months, as they're doing better, they say, I don't want to stop.
Yeah.
Because my
feeling so
quality
much
of
better.
life is so improved.
Yeah.
And with antidepressants, there's no evidence of any problem on long-term use.
And that's important to remember, that depending on how you're doing, depending on the things that are going on in your life, you may come off, you may restart medication, and there's no shame associated with doing any of that. No. It's like I've always said, like, recovery is a process, it's not perfection, and it's having a team of people and professionals behind you to help you know if you're doing poorly, it's okay to go back on or to continue on. If you feel like you've really improved because of the medication, like my video I put out with Paul Gilmartin a couple weeks ago, maybe a month ago, where he said that he thought he was doing so well on his antidepressant and he felt so much better, he stopped taking it, and then he got really suicidal. Yeah. And so it's important to know that if you're feeling better and you think it has something to do with the medication, maybe you stay on it.
That's right.
So.
That's right.
There is so much we can talk about when it comes to medication, but this is just an intro for all of you so that you know kind of what to expect, that not everybody has to be on medication, you don't have to stay on it forever, but it's something that you should really talk with your doctor about and educate yourself so that you know how to better get the treatment that you deserve. Thank you so much, Barry, for sitting down and taking time. And thank you all for tuning in. If you haven't seen the other videos I've done with Barry, make sure you click here to check out another one, and don't forget to subscribe. And I'll see you next time. Bye!